I understand you're not doing very well with your knee. We gave you cortisone injections. They helped a little bit. Synvisc injections, they helped a little bit. Now they're not helping. We did a little therapy. But now you're to the point where, just doing some of the things every day, it's a struggle. You have pain every step you take. You can't go to the mall and shop. You can't exercise the way you want to exercise. We just took these x-rays today, and you can see that this knee is worn out. The medial compartment is actually bone on bone compared to your other side. I mean, actually, if I would rate this knee, it's probably a 10 out of 10. This knee is worn out. We really have to talk about something other than just conservative measures. We have to talk about surgery. And I'm not talking about arthroscopy where we just trim things up a little bit, but actually operating and doing a total joint replacement. Now, there is some good news. I mean, there are two things that have happened over the last 18 months that are just incredible. One is robotic-assisted total joint replacement, and that has been unbelievably fantastic, not only for me, but for the patients. And the second is called Iovera. It's a method in which we inject around the knee to give you nice pain relief during that rehab process for actually 54 days. And this has been outstanding so that you don't have to take all these narcotics and that you can get your range of motion and do some really, really good things. So let me just take you through what we're talking about, because I've had robotic surgery. I had both my hips replaced. I went to Chicago. I had robotic hip replacement. I didn't even understand what this was all about until I saw it. I'm thinking that this robot does all the surgery. That's not true. The surgeon does the surgery. But the robot puts the tools that the surgeon uses in place so that it's perfect, its accuracy. So what we do is we have you go get a CT scan. And the CT scan then takes a picture of your knee and it says, you know what, instead of being like this, your knee is like this. Bone on bone right here. Then we use all that data. We make an incision. We then identify about 150 points. Now the computer has all the information that we need to take a situation like this and make it like this. So that's what's happening. We have data of your present knee. We know after your prosthesis where we want to be. And then the surgeon has to tell the computer, how do you get there? So what we're able to do, and this is the cool thing about this, we're able to make a cut that is 1 degree, 2 degrees, 3 degrees, so that we change a situation of this to this. So it takes us probably about a minute to do this. We tweak the bone this way, this way, this way. Oh no, I think it should be back this way. And we make sure that before we even cut, that our gaps, which are so important, are exactly 18 millimeters in extension, 18, 18, 18, 18 in flexion, so that you have such good stability. And when you have this great contact throughout range of motion, this knee is going to last forever. So that's what we do. Then, this takes 43 minutes. The robot is just so accurate, precise, that it always takes 43 minutes. Then you stay at our recovery inn. Our recovery inn has been around for about 6 years. You stay here for 2 days. It is fabulous. The food is fabulous. The Cajun mac and cheese is fabulous. The sirloin tips are fabulous. The food is excellent. We have physical therapy. You get to see me every day. And we really push you into the next 6 weeks with a fabulous start. You're going to be using crutches or a walker for about 1 to 2 weeks. You're going to be using a cane for 2 to 3 weeks. The big deal, and this is very big, you're going to be driving in about a week. No one really tells patients this. They come in, they say after 3 months, can I drive? You know, people get depressed after knee surgery or hip surgery or shoulder surgery. They're in the house for such a long time, and so I encourage people to drive if they can do it safely. They're off their narcotics. They can drive. So the other component of how do you get off your narcotics is the Ayurveda. It's a process in which a week before the surgery, we inject your knee. Some of the superficial nerves are deadened temporarily for 54 days. The pain goes down to the point where you don't need very much narcotic. And you can get your range of motion, you can exist, you can drive, you can do all these good things and not feel like you just had major surgery. So this is so good. You know, the other component of this, which is probably close to being the most important, is our infection rates. The infection rates at our surgery center are extremely good because all we do is orthopedic care. So this is something that you will get a good result. I will change your life. You'll be able to walk again. You'll be able to walk without pain again. You'll be active again. You'll feel like a person again. Let's do it.